So just complimenting what Dara was saying about myself. So I did vet school in Brazil. It's slightly different than the US. It's more like a bachelor degree than a doctorate degree. It's a program, very intensive. We pretty much cover the same amount of stuff. It's just slightly different. After I finished vet school, I decided I want to go more into research. And that's what geared me to go towards my master's. So I came to the US. I did my master's at the University of Idaho. Focus on the bull fertility side of things. And then I moved to South Dakota State University to do my PhD there, and I continued to focus on the bull side. I did a year of postdoc, focused more on the extension side of things. And then I was hired by UT to be the extension beef cattle specialist in the reproductive management there. I did not prepare this presentation on time, so that's why you guys don't have a printout of my presentation. I finished this presentation yesterday. So if any of you want this presentation, feel free to contact me or anybody here in the group. We can get you this. Here's my email and here's my cell phone. If you guys want to call, text or whatever on anything reproductive related. I know here in Kentucky you guys have Les Anderson that is really good. Reproductive physiology as well. But if there is anything I can do for y'all, feel free to contact me. The way I set up this presentation, there we go. The way I set up this presentation, I will have a brief introduction here about bull fertility and bull in general. Then we move into the health considerations and how to maintain a healthy bull, and then go into the fertility side. I want to say, and I hate to admit it, especially because we have a nutritionist here, but the nutrition portion is extremely important when we're talking about bull health, bull development, bull fertility. Katie did a really good job on covering that portion. If you guys have any other questions that we haven't covered yet, feel free to just shout it out and we can continue to go into some of that. But as Katie said, we have a lot of research on other topics related to the bull, not as much on the bull nutrition side. We understand a little bit about the early nutrition and some of the impact the early and later nutrition on their fertility, but not a whole lot. And if you notice the references, they're early 1980s, late 1980s, early 1990s. That's kind of where most of that research was done or went. So we're talking about the bull, right, specifically. And I think another point that is important that Dara was mentioning about this presentation, it is step away from the heavy genetics that we were having, that we had with Matt, with R, with Troy. And I think Katie and my presentation goes on what they heavily talked about on their presentation, that E component of that equation there. So on the environment, on what do we do on the environment, that please correct me, the geneticists, if I'm wrong, but what we are trying to do here with this management type of deal is to allow those bulls to express their genetic potential. That's basically what we are trying to do here, to not inhibit it. So trying to not do anything that will not allow them to express their maximal potential. So when we're talking about the bull on the management side, bull has only one purpose on any operation, right? It is to get cows pregnant. So what we're trying to talk about here is what can we do to maximize the amount of cows or optimize the amount of cows that those bulls can get pregnant with one breeding. The genetic value here, we've been hitting this pretty hard. Everybody have mentioned it, right? So one single bull has a bigger footprint genetic-wise than any single cow. Even when we talk about all the reproductive assisted technology that we have available with IVF, with embryo transfer and everything, we can spread a little bit the footprint of our cows, but it is not nearly as large as any single bull, especially when we talk about AI bulls. When we talk about economics, and we have our economist sitting right there in the back, and it's a pretty old reference here, but the point of this, when we talk about the reproduction, is 5 times more important than growth performance, and at least 10 times more important than product quality. I'm not telling you that growth performance and product quality are not important. That's not what I'm telling you. What I'm telling you is If those cows don't get pregnant, those cows don't produce a calf, those cows don't wean a calf, doesn't matter the genetic potential of those calves that could be born. They have to be born before any of that to have a value. And I think Katie mentioned a little bit about this too. Natural service is pretty much the main point or the main way we breed our cows or the beef industry. Dairy industry, that number's flipped. Over 90% of our dairy cows are bred by AI, not natural service. When we talk about beef industry, 92% of cows, 76% of the heifers were only exposed to bulls. So they were not AI, they didn't see anything, any other method, just a bull. So having those bulls healthy and making sure that those bulls are fertile is extremely important for us to reach that point of maximizing the amount of cows pregnant, getting those cows pregnant in a timely and efficiently manner. So, as I said, usually when I give this presentation, I have a big chunk of that focus on the nutritional side because that's really important, really important and really impactful on those bulls' development. But since Katie already covered, I'm going to jump right into our health considerations here. So when you're talking about the health of those bulls, we need to think about what conditions we could be looking for, right? And there's these conditions right here in the top. Those will impact the ability of the bull to actually breed those cows or directly impact the semen quality. That'll be yawns, pink eye, vesiculitis. We'll talk a little bit about this when I get to the breeding sounds exam there. Lameness or other injuries. So that impacting the actual bull. Then we have this other disease here, protozoa, bacteria, virus, bacteria, all those that impact not only the bull, but also overall herd fertility and the ability of those cows to get pregnant, and also the number of calves born or when those calves are born too. So, and then we are going to cover those later on. Let's focus on this portion here first. So let's start with our venereal disease here. And those are the ones that are sexually transmitted. So an animal will transmit through this sexual intercourse there between them. That is the Campylobacter there, and then trich, right? This is also known as Vibrio. Here is our first portion there. And I'm going to kind of combine Vibrio or Campylobacter and trich kind of in one and most of this slides here because their symptoms and what we can do management-wise are very similar. So we're going to combine them. So this is kind of what it looks like when you do the analysis there, get those flushes. That's what we're looking for. This is a Campylobacter fetus, the protozoa there. It stays in the reproductive tract, so you're not going to find anywhere else, and it's transmitted by coitus, so a bull mating a cow. When we talk about the trich, it's a protozoan. This is what we're looking for, so we do that flush there, or we're looking at an ejaculate, so this is a sperm right there, and that's the protozoa. Both of those, the male is the carrier, right? So it will live in the prepucius of that bull, the prepucial cavity there, and those protozoas will be swimming in this magma there, and it's favorable on the anaerobic environment, so that without oxygen that we have there in that prepucius. And that's how it's going to be delivered. So when it's mating, it is introducing those protozoas from the bull into the vagina of the cow. Talking about the clinical signs of this Chu disease, the bull usually don't have any signs. So you're not going to notice anything different in the bull. So that's what we say, that's what asymptomatic carriers. When you talk about younger bulls, they can be transiently infected, meaning they get it and they get rid of it by themselves. Older bulls usually are those that get chronically infected, so that when they get it, they don't get rid of that disease. But it's important to remember that it is possible, and in some cases, those younger bulls also may be chronically infected. And before I proceed here, I just want to shout out to Dr. Louis Strickland. He's our extension veterinarian. He provided me several of these slides, especially on the health side. So continue on the clinical side, but now looking at the female, right? So these are on the bull. Now let's talk about the females. The main thing we see here is that infertility related to early embryonic mortality or fetal death. What is that? So those protozoa, when they infected the female, what they end up causing is an irritation there in the uterus, in the vagina, cervix, and that end up causing early embryonic. So what you see on the female is those prolonged estrus. So instead of the female showing estrus every 21 days, they end up being 30, 40, 50, 60 days between an estrus and the other one. That is one of the signs that you may have trich or campylobacter going on that herd when you start having those prolonged estrus on those females. Usually it clears in approximately 40 days. Some cows may be chronically infected, but it's extremely rare. That will be like less than 1% of those females. The literature said most of those females will clear between 6 and 8 weeks, but some may take up to 20 months or 15 months, depending which one of the two you're talking about. So there is some variation there on how quick they clear that. Late-term abortions also, so that's what I'm saying here, less than 1% here. Late-term abortion, those postcoital pyometra, so that's basically what this is compared to a normal clear mucus that should be coming out of that cow. Those are some of the symptoms that we can see on the female side. Okay, other methods of transmission, right? We're talking about venereal, so it's bull to cow, cow to bull. So a contaminated bull, which we said in the beginning is the carrier of that, will transmit to cows. But a clean bull can come behind and breed those cows that were contaminated and also contaminate themselves. So that's kind of how that spread. Bulls are usually the ones that are chronically susceptible. Bulls breed infected cows, as I just mentioned. Young bulls can serve as the mechanical vector there, so how they transmit from one to another. Not cow to cow, right? Use seeders, maybe. That meaning you get a used seeder, you don't clean it well, you get from one cow that has it and pass right away. Very rare, but it could happen there. Although reusing seeder is not recommended, it's not on the label. I know some people do it. If you are doing it, just make sure you clean it well, put disinfectant and everything before you reuse it. Contaminated applicator, so you're using the same applicator, right? That's a normal routine thing we get from one cow. Go there if you don't clean, so have a water with disinfectant there so you can clean it well. If your herd has this disease, there is a prevalence of that. If you have find cows positive for that or bulls positive for that. Bull to bull, not very frequent. Maybe something like this, but really there's not a whole lot to know. Just assume that one contaminated bull will not pass to another one. Usually the way they contaminate itself would be they're in the same pasture breeding cows. One has pastured a cow, and the other one go breed it and get it. That's more common. Talking about diagnostic of those disease, it's a preputial wash versus scrape. So just using different methods here there when you scrape it, or just a wash and collect the fluid to do that. We can use the culture way with the pouch there, or use PCR to there. Vibrio, there's this Clark median. No need to get in much details there on how to diagnose it. Basically, if you have any suspicions that you may have it, just call your vet. They'll come here and they'll do whatever type of exam that they think they are more comfortable with. They are all equally good on detecting those disease. This is an interesting point here. 3 tests 1 week apart after 2 weeks of sexual rest. So 2 weeks of sexual rest, basically if they're that transient infection, they can clear it out. And then 3 tests, because so you do one, if they're positive, you come 1 week later and do another one. If they're that transient infection, they may clear it out. If they're all 3 positive, they're considered that chronically infected bull. There you go. treatments, right? So that's what I was going to go into right now, not for trick. So there was compounds that were effective on clearing it out, but all of those are prohibited to use in livestock species because of human use. So they got prohibited use on food animals, or because of residual on the meat and things like that. So we don't have, the only thing for trick that we have available will be trick guard, the vaccination there, or we go ahead and use AI, right? We remove the bull from the picture, go straight to AI, and then you can get rid of that. That's another possibility. And AI here is different than the one that Troy was talking about. This is the artificial insemination, artificial intelligence. When we talk about Campylobacter, same thing. The only thing that we have would be the vaccination. There are some reports that it could cure an infection, but it's very limited. I think the main thing when we're talking about this two disease here is biosecurity. Test your bulls usually are the only ones coming in and out, right, of the herd. Most places don't have a whole lot of cow movement coming in, but make sure you do quarantine if you have any cows coming in. Test them as well. Don't buy open cows, older cows. If buy virgin heifers, open, but not open older cows. That's another way you can prevent that to coming in. Every bull that you purchasing and bringing in, make sure you test them for those disease to make sure you're not introducing it. Because if you don't bring anything that are carriers of that, you don't need to vaccinate. You do the prevention is much better than any type of treatment on that side. Then we get into our viral disease here, right? So the two main ones probably is BVD, so bovine viral diarrhea virus, and bovine herpes, which is the IBR there. Very similar here. Both of them are contact type of exposure there, from nose to nose, fecal, that type of deal between an infected animal and a healthy animal. That's how they pass along. When you talk about the BVD, we can see abortions, birth defects, some death after birth, but the biggest issue that we have is this one, right? The persistent infected calves. Those are the animals that host that virus. They are infected in a window, in a certain window of gestation. They are born healthy. They are not healthy, but they're a little lower. Usually the vitality of those animals is lower. They're not as strong when they're born, but they're persistently infected, meaning that they will never clear it out. Shedding of that virus is intermittent, meaning that it's not because they're shedding today that they're going to be shedding tomorrow. It goes in waves. So they share and stop, shed and stop shedding throughout their life. Big impact on production in general. And I'll tell you this. We did a research when I was in South Dakota, and even on well-vaccinated herds, if you put a PI animal around and there is a transient infection there going on those females, even when they're well vaccinated, you see losses on pregnancy rates. We did see about a 20% decrease in final pregnancy rates on our heifers from those infected herds that had a PI calf going on compared to those herds that didn't have a PI calf around. So even in well vaccinated, it's not as bad as if the herd was naive. Okay, if the herd is naive and you had an infection, it's really bad. But in well vaccinated, what I'm trying to tell you, biosecurity again, going back to biosecurity, it's important to isolate, make sure that those animals are healthy before you introduce them to your herd. Usually on the herpes virus, IBR, we are going to see more of that abortion on that last trimester, and they don't have treatments. The only preventive is vaccination and biosecurity. Leptospirosis would be another one, and we're talking about bulls and cows, right? I'm kind of talking a lot about the female, but like thinking about the bull as also part of the herd, being the carrier there, or potential carrier. There are some that cattle is the host, some lepto bacteria there that is the cattle is the host, such as, so that will be a high disease or subclinical disease and low antibody response. Usually if you're, the way Dr. Strickland explained is, okay, if you're seeing an abortion here and abortion there, most likely those are the cause of it. So, but if you're seeing a massive case of abortion, so there are several cases going on, several cows, a high percentage of the cows aborting at once in a short window, usually you're talking about this, okay? Same thing when you're talking about there, prevention will be water source replacement of animals that are positive, mainly for those ones when you identify those animals. Testing is another thing that's really hard on these ones because not necessarily they're shedding the whole time. They can be shedding like BVD, like the PIs. You may test them, they come negative, but they might not be shedding right now. It could, and then you come test them later, they might be shedding. So that's where it becomes very tricky identifying those. Those one is very high incidence, and you treat them and they clear out. Well, actually, you can treat cattle, but vaccination will be the main thing there, beginning early life and giving boosts according to the label there, and consistent boosts. I think it says, if I remember correctly, it's about every 6 months you should give a lepto boost. Those other viral disease that usually they come on, like you have a cattle master or other brands there that you're using to vaccinate, they all come together in one. The lepto needs to have a separate booster, and you can find those also available. When I'm talking about water source, it's more likely them contaminate with in a water source like this than if you have a trough or something like that, that the water is coming and going. The reason is wildlife could come here, animals could die and defecate and all that there and contaminate that water more easily than in a trough that you can wash and clean. What kind of vaccine should we give to bulls, right? That always become a question there. So generally we're talking about vaccinate them as calves, then 6 to 8 months, week prior to the breeding season, because we want to boost their immunity right before they go in there. And we're going to talk more about why 6 to 8 weeks becomes important number there, especially more towards that 8 week than that 6 week. In general, we're talking about IBR, BVD, PI3, BRSV, and usually that comes with lepto together. Usually you can buy those all together as one thing. One thing that, and actually I was talking with a guy from Select Sires recently, if you have any intention of putting bulls on Bayer, on Select Sires, ABS, any of those places, especially those that do international trades, talk with them also for vaccination protocols, because some of these vaccines inhibit the ability of exporting semen. I think IBR is the main one there. There are some countries that do not allow because the bull will come up positive, with the vaccine will test positive. They are clear, they don't have it, but because they've been vaccinated, they'll test positive for IBR. And then some countries do not allow you to import semen if they test positive. It's a little heavier on the dairy side. I know they're a little more lax on the beef side, but if you have any intentions there, just talk with them and it can help you figure out what to give and what not to give for those bulls. Same thing as your vet. So consult them not only for all the general vaccination protocols, right? That's the best person for you to go to figure out what vaccines make sense for your herd. Maybe you want to talk about more than just those ones, but also testing for Trich and Vibrio or Campylobacter. It depends how much you're familiar with, but usually used to be called Vibrio or Vibriosis. But testing those animals. As I mentioned, if you're introducing an animal, I think that's a really good idea to always do that test on those bulls coming in, or even on those cows. Try to test them before you introduce them to your herd. That probably is the best way to prevent introduction of this disease in your herd. And then this one is another vaccination that usually we do as calves and we stop doing it later on in their life. And when we're thinking about bulls, especially when we have multiple bulls in the operation, I think that's an interesting one to continue doing on those mature bulls because of fighting. And that fighting can actually induce some of those Clostridium infections to actually start proliferating and cause problems. So I think that is another one that's good for especially for on the bull side. Okay, talk about those portions there. Parasite control very briefly here. Basically, the recommendation there is just match your cow herd. Whatever you do for your cows, do the same thing for your bulls. Deworm your bulls at least once a year. That's usually okay. As I was reading some references there, they mentioned that on the southeast Tennessee, or sorry, the southeast U.S., basically where we are here, right? We may need more, and that's because of the length we keep those animals on pasture. Basically, we may need more. But if we can deworm them before the beginning of that breeding season, getting them time to get in and a full-blown their health, none of those things impacting them. And on the fly control, another reason that's important, not only because it bothers the bull and that bull may be trying to fight that fly instead of trying to figure out which cows to breed, they can have some flies on the testes there causing testicular irritation, and that could impact and causing that scars in the testes and impacting that thermoregulation that Katie mentioned a little bit. And I'll talk a little bit more about thermoregulation in a few slides. Okay, now last bullet point here will be the breeding sounds exam, right? So when you're talking about fertility, right, the breeding sounds exam basically is we're trying to figure out if that bull is fertile or not, or if that bull is a potential breeder, right? That's what we're trying to figure out here. And there are several things that impact that fertility ability of those bulls. One is the body vigor there, the physical sounds of that bull, structural conformation, masculinity, and then general health of that bull. Okay, so going more in depth on those things and thinking about what we do as industry-wise, thinking about EUS. USDA usually has a survey that happens every so often. I think it's every 5 years roughly that they do it. And then they ask the producers several questions. One of them is if they test their bulls. About 67% of the producers respond that they semen tested when they buy, lease, or borrow any bull. However, only 31% of those producers tested the bulls that are already on their operation. Okay, let's talk about this. But first, what is the difference between semen tests and a complete breeding sounds exam, or complete BSE? I don't know the difference, okay? Because I don't know exactly what they're doing on semen tests. I know it's a complete BSE. I'm not sure what is semen test, okay? And what is they're classifying as semen test. That's one big thing there. So let's talk about the BSE. Okay, and I hate the term like I'm using here, a complete BSE, because it's either doing a BSE or you're not doing a BSE. And a BSE is composed of these three components here: physical sounds, scrotal circumference, and then the semen quality there. Physical sounds of that bull. And I was talking with some people the other day, and it's funny because when a veterinarian is doing a true breeding sounds exam, guess what? That bull needs to be palpated. You just leave that bull. You go check those accessory sex glands. You check the structure internally too. And every now and then, the person I was talking with got a phone call, say, hey, what is your vet doing here? He's preg checking my bull. Right? That tells me a lot that the previous experience doing BSE wasn't actually a true BSE, right? Because you're not checking everything that bull should be checked for. And basically, when you're palpating those bulls, what you're trying to find is abnormality. If everything is right, usually there's not much to feel. But if there's something wrong there, especially infection on those accessory sex glands, that's usually when you see big abnormalities there, and that's what we want to avoid. Other things, we need to look at the full structure, outside structure, so that prepuce, the penis, look at the head of that animal. Basically, is that animal fit to go to the pasture, eat, maintain its condition, but also when it needs to be doing a job, so going there, mounting and breeding cows, it is actually sound. It's not a bull that is going to go there, maybe mount one cow, now it sores on its leg, and is going to go lay in the shade and not going to try to breed cows. That's what we're trying to look for when you're looking at basically the structural sound or the outside structural soundness. That's why when we talk about feeding leg structure of those bulls, that's what is really important there. Figuring out those bulls that can stay there, do their job, and the feet and leg of that bull is not going to harm them or interfere with their ability to do what they're supposed to be doing. Scrotal circumference. Katie mentioned a little bit about scrotal circumference and changes there with nutrition and everything. Basically, when we were measuring the scrotal circumference, we were having an estimation of semen production and that semen quality. We have genetic correlation of scrotal circumference and age at puberty of those heifers, so the offspring of those bulls. Meaning that when you have larger testes, heifers will become pubertal earlier. It is not a huge difference, but there is a correlation there. Another thing that is important to remember, those are minimum standards for scrotal circumference, and that's based on age of those bulls. Minimum standards. Those bulls that don't meet minimum standard, that means they are subfertile. Their potential for fertility is lower than those that meet. Doesn't mean, and that's why there is a minimum standard there, that's 37. Let's say a 2-year-old bull, one is 34, the other one is 37. Does it mean that the 37 is better than the 34? No. Both of them have sufficient testicular size, okay? That's what that means. And then finally, the last step here is that semen quality. And on semen quality for the breeding sounds exam, we should be looking at 2 different categories there. One is motility, and that's a fairly easy bar to cross. It's a 30%. Only 30% of the sperm that you're looking there needs to be progressively motile. However, morphology is a much higher bar to clear. And research have shown us that when you lower that bar, you start having subfertility on those bulls. Okay, and we'll talk a little bit more about that subfertility soon. Okay. When we talk about the classification, they can be classified in 3 different categories here. Sexuatory potential breeder, meaning that they're sound bulls, they have minimum scrotal circumference, they have minimum semen quality, so 30% or more motility, 70% more morphology. That's why I classify them here. Now, if any of that is wrong, now they can be classified in one of these 2. What is the difference? Sexuatory potential breeder, meaning whatever problem we identify during BSE will not recover. That animal will not get better with time. However, if that problem may get better, we should classify those animals as deferred. Meaning that, okay, if we wait that problem, so that bull might be getting over a disease. That bull is too young and immature. Maybe with time, that bull will mature. It'll get a good semen quality. So depend what it is. So we classify defer and we come. So, and usually we say about 60 days to come back. Why is that? And now is where I'm going to try to get a little more technical here. With this. 60 days. Spermatogenesis, that's a fancy term there. That's basically production of that sperm cell the whole time. takes approximately 61 days, meaning that the spermatocytogenesis, and I'm going to go explain a little bit what those means, takes about 21 days, and meiosis 23 days, and then spermiogenesis 17 days. And then we have the epididymal transit that's about 8 to 11 days. Okay, that means that sperm is produced here, is released, goes here, and then transit here, and then is stored here. That's what all the thing that we have talking there. That spermatocytogenesis, meaning, so sperm cells start with a round cell as every other cell. Now it's going to start dividing in a bunch of cells. And up to here, they're just dividing cells. There's not much going on in there. When they get here, and they move compartments there, we're not going to go in that detail, but they start having some cell, we start having cell differentiation there without cell division. And then these cells go through a cell division that is the meiotic portion of that cell division, meaning instead of having those two pair of chromosomes, I think we got a pretty clear picture there when we have Troy, Matt Stock. They will have two pairs, one maternal and one with the father, one with the mother. You split that. And some of the genetic variation that they're showing happens at this process right here, on that meiotic portion, where those chromosomes will cross and piece of your maternal chromosome cross with your paternal chromosome and create a new chromosome. That's kind of what they're trying to explain, and that's when it happens. Then, after that meiotic division, that's where that round cell starts changing shape to form the sperm that we know, that has the head and the tail. And after that spermiation, after the release of those tubules, that sperm goes to further maturation as it goes through all these tubules here, all the way to gets to the cauda, or the tail of that epididymis, which is right at the bottom of the scrotum of that bull, where the sperm is stored there until it's ejaculated. Now, when a bull usually is classified as deferred because of semen quality, that's why we usually talk about 60 days. Because to go through all this process, so we don't know where that injury happens or when that injury happens and when that injury will clear. So usually after that injury clear, whatever they had, it takes about 60 days for us to see that new spermatic wave, so that new sperm coming out in the ejaculate. So that's why that's 60 days. Okay. Why is BSE important, right? I tested my bull, that bull passed. Why do I need to keep retesting that bull, right? Okay. Almost 3,000 bulls there, data collection. 18% of those bulls failed. And a deferred bull, at that day, that bull failed. Okay, it needs to be retested, but think about the deferred bull as failing at that day of the BSE. 1,200 bulls tested, beef and dairy bulls there, 37% failed. About 200 bulls, Holstein bulls, yearling bulls, 36% of them failed. 57% of those bulls, so about what, 18%, just because of physical exam. So they're not fit to go in and do the job. Okay, this one can be a little tricky to understand. So bulls that pass a BSE have at least 5% greater pregnancy rates. Okay, 5% may not seem a lot, right? The way this research was designed, it was this. They got a group of bulls. They cut that group of bull in half. These half, they tested. These half went with cows. So we're not talking about single bull going there. It's a group of bulls. The tested group, that only the bulls that passed the BSE and went out with the cows, have at least 5% more pregnancy rate. That's what that means. Now, thinking about our producers, Kentucky, Tennessee, most of our producers have one bull. How much is the impact of that one bull if that bull is the one that don't pass the BSE? How much the impact? Is that much more than a 5%, right? When you talk about economic benefit there, and I like to throw that country there, I'm not sure why, but I kind of like that country. So For each dollar that we invest doing a BSC, we have anywhere between $17 and $36 in return. So it pays off, right? Other things that we have to remember here. That BSC is just a snapshot. Meaning, we test the bull today, we don't know what's going to happen tomorrow with that bull. So we cannot guarantee that tomorrow, a week, a month, 2 months, that bull is going to be good. We know that today that bull is good or bad, right? So things could change. Right? We have to keep that in mind. That's why we need to test that bull before it goes with cows every year or every season if you have a spring and fall. Same thing. I showed you, what do we test them for? We look at the structure of that bull, we look at the scroll circumference, we look at motility, and look at morphology. Katie showed you data on that study. And another thing that I want to compliment on that study is there was no difference in semen quality in that study. But they saw a difference in embryo production. So there are things that we still don't understand that goes on in there that also impacts fertility. This is the minimum we can do to guarantee, because we know those bulls that fail will have lower fertility compared to those that pass. Right? It's currently the best or probably the only method that we have to evaluate bulls' fertility, the BSE, so we need to continue doing it. And another thing that's important to remember is your veterinarian is not failing your bulls. The bull failed itself. It's the bull's fault, not whoever's testing that bull. We have to keep that in mind. Okay, there's other things. The BSE is not perfect. Libido is not measured, and we know if the bull doesn't have interest to go breed cows, we're not going to get cows pregnant, even if that bull has the best semen quality and the best structure, right? This is a study that's, not a study, but a picture from Dr. Barth, very renowned male physiologist. They had this bull here, old bull there, that they keep on purpose. That bull passed his BSE every year with flying colors. And we have here a younger bull. Put there, the cow is in estrus there, doing a libido test. That bull does not want to do anything, doesn't want anything to do with that cow. But that young bull goes there and do the job. I'm not saying older bulls don't have libido. Don't take me like that. But I'm telling you, understanding that libido is important. And the best way to do it, either you do or you tell the people buying your bulls, is when you put that bull out with the cows, just watch to see it go there and do the job. Right? There's always some cows in heat. When you're putting them there, just make sure that the bull can go there and do their job. That's basically what it is. It has interest in doing the job. We already mentioned a little bit this, but the testing for venereal disease is not part of a BSE. But we should encourage that, especially when you're buying that new bull. Or if you have a herd that has had problems with those with Trick or Vibrio. Serving capacity or serving ability, again. Serving ability, just make sure that a bull can go there and actually do their job and breed the cow. Serving capacities, how many cows can a bull breed? And that's a constant question. A good rule of thumb, not very scientific here, but if we're talking about mature bulls, 25 to 30 cows is usually safe there. It depends what other breeding strategies you're using. You may go as high as 1 to 60 and still be successful, not compromising. But it really depends on your breeding strategy, your everything else there. When you're talking about younger bulls, that's where our numbers goes down. And a good rule of thumb there is 1 cow per month of age. So usually we don't put anything younger than 15 months. And I know from my interaction with several of our seed stock producers in Tennessee, they tend to hold those bulls until 2-year-old before they sell. And the reason they won't do it, it goes along with how nutrition is important. And I'm saying that again, and Katie is hearing that. She's going to call me out on that. Those bulls are still developing, right? From that 15 to that about 2-year-old is when they're pretty close to that mature size there. When you get those bulls 15-month-old, they're fine. They can go breed cows. But if you don't keep them on a way that they can keep growing, you can harm those bulls and then sacrifice the next breeding season, and that producer may come back and say, hey, your bull is bad. So that's kind of what some of our seed stock producers in Tennessee have merged to, selling older bulls to avoid that problem with miscarriage of those bulls when they're younger in that scenario. Last thing here will be the social dominance there. And that is a big thing, especially when you have more than one bull in the operation. The thing is, bulls will create a hierarchy. They will establish who is the dominant bull, who is the last dominant, and so on and so far as how many bulls you have. Talking about multi-sire pastures, a recommendation, a good advice is, one, try to not mingle younger and older bulls, because usually size plays a big role there on who is the dominant bull. Well, you're bringing the young bull because usually it's a better genetic, right? You're trying to, the younger generation there, it's better genetic. You're trying to put more of that. But then you have your older bull with that younger bull, and that older bull is not going to let that young bull breed as many cows. So that's one thing that we need to be careful of when we're mingling them. Another thing is, if you're putting more than one bull in a pasture, usually it's better to put them together before you want them to start breeding. So for example, you do a fixed time day eye. Those cows should be coming back in heat somewhere between the 14, 18 days after their first breeding. Normal cycle would be somewhere early cycle and normal cycle early ones, 14, 18 days. So putting those bulls 5 days, 7 days before that, then those bulls can fight each other, figure out who is who on that hierarchy establishment, and then when the cows are coming back in heat, they just go and breed cows. They're not fighting each other and leaving those cows coming back in heat. Now this is another number here that may seem easy to misinterpret it. What I'm trying to say here, so those are multi-sire pastures. I think that one they had about 10 bulls in a pasture. And with 10 bulls, there was one bull that bred about 30% of the calves. So, and they have another study, I'm not sure if that is published or not yet, but I think they had 12 bulls in a pasture. 4 bulls bred 85, the next year when they look at the calf crop, 4 bulls represented 85% of the calf crop out of those 12 bulls. So we don't fully understand that social dominance and what drives that, don't completely understand it. But we know when you have multi-sire pasture, there will be bulls that will breed way more than what will be the normal percentage expected from them. And there will be bulls that will have 0. And all of them pass the breeding sounds exam, so all of them should be fit to go breed cows. Now, when you're talking about the importance there, now imagine that subfertile bull is the dominant bull in your pasture. You have a multi-sire pasture, that subfertile bull is the dominant. What that will do with the calf crop, right? And when we talk about subfertile, okay, I'm not talking a bull that will give you 0. That's an infertile animal. A subfertile bull is you're expecting a 70% pregnancy rate with one service. That bull is giving you a 30. So you'll get calves next year, but it will be spread farther. So that's basically what I'm talking here. When we have a subfertile bull there, we're going to have a decrease on calf crop, not a 0. Delaying pregnancy, decrease in weaning weight. Basically, what this means is we have lower pregnancy rates. Those bulls need more chances to get the cows pregnant. Meaning, okay, you got 30% pregnant on this service, so now more cows will come back in heat on the second service, and he may get about 30% of those, and then 30% of the next, and that keeps scrolling it. What happens, and those two are kind of interconnected, this is research has nothing to do with subfertile bulls, but it's a good example of calf distribution that could explain some subfertility. This pretty much shows us that calves were born about the same rates or same number of calves born throughout their calving season. It's almost steady. When you have a subfertile bull, that's kind of what could happen. And what we really want to happen is put high fertile bulls to have curves like this. We have more cows getting pregnant early, more cows calving early, and then slowing down later. Why? How many of you wean all your calves at, let's say, a day or a week? I think pretty much everybody, right? Within a very short period of time. Okay, now I have 120 days, or even if you have 80 days or 90 days calving season, that calf that was born on the last week has 90 days less growth than the calves that were born in the beginning. How much did that impact on their weaning weight, right? As a seed stock producer, that calf value is different, but think about your commercial producers that buying your bulls. If that bull is subfertile and doing that line for your producers instead of doing this, and where they're paid by that weaning weight, right? How much that has an impact on those producers. Goes back to my first slide, right? Reproduction is more important than performance. If they calf early, you're going to automatically wean heavier calves if they calve all sparse. I think I'm about on time. So in summary here, that goes back to Katie's presentation. Proper nutrition is the key for reproductive success, making sure those bulls are fit, good body condition, healthy before they go out with cows and the development of those bulls. Biosecurity is key for animal health there, so avoid introduction of new animals to the herd. If you are introducing new animals, quarantine those new and re-entering animals. So if an animal goes to a show and come back, do a quarantine on that animal before you put in your herd, so you're avoiding bringing any bugs in there. Vaccinate, deworm, control flies, and that goes both bulls and cows there. Routine BSE, and that educational portion goes not only me to y'all as a seed stalker, but I think needs to go from you to your producers too, as when they buy your bull, tell them, this bull has passed the BSE that I'm giving you, but it needs to be retested every year to make sure it still pass, and if that bull fails, come back and you can buy a new one, you know? We'll have more bulls. You know, bringing that to your producer that bull, if that bull fails a BSE, is not going to do any good for them. It's not the cost of losing a calf crop or delaying the birth weight or the birth of those calves. It's way more than buying a new bull. And BSE is the only method we have to evaluate bull fertility. We know that it's not perfect, but it's good. So with that, if you guys have any questions,